We are the Convention Center, Washington, D.C., downtown, and we are part of the American Academy of Pediatrics annual national meeting. With me is Dr. Cora Breuner. She's a consultant pediatrician, and she's been part of the faculty that has been giving lectures during the workshop seminars, and her emphasis is in integrative medicine. Dr. Thompson NTUBA is the editor of Health and Development magazine, and I'm interviewing Dr. Cora this morning, and I have the pleasure to bring her to you. Good morning, ma'am.
Good morning.
Can you tell me and the audience who you are?
My name is Dr. Cora Breuner, and I'm a pediatrician and adolescent medicine specialist at the University of Washington and Seattle Children's Hospital.
You were invited and you are here, and basically I think this is the second session that you have done on integrative medicine in pediatrics. What has been the focus and emphasis in your presentation?
Well, both presentations are about trying to teach the pediatricians in the community. The focus of the interviews, the focus of my talks has been to incorporate studies of supplements and ergogenic aids in the adolescent athlete and young athlete. And I've also spoken today about incorporating mind, body, and spirit approaches to the pediatric patient in your practice.
There is a lot that people would really want to ask questions, especially some of what is to take place in terms of praxis. Some of the things which you expect from the patients are not what you expect little kids to be able to do. So how do you circumvent that? How do you really get them really practice that so that they can benefit from the practice?
That's a great question, Dr. Thompson, and I do feel that we need to use the techniques that we use in our adolescent patients and young adult patients and take them all the way down to our youngest toddlers and infants. And of course, importantly, to take these practices into our parent population as well and other guardians that take care of our children. What we
Uh,
notice is that there's a lot of kids from infants and toddlers all the way up to young adults in the pediatric world that have chronic pain, such as headaches and abdominal pain. And many of the techniques that I taught today in the workshop are also ones that can be easily translated and used in the clinic. We have, clearly there are many, many things that don't work, which include medications or other things that just don't seem to help these children. But we do know that hypnosis and acupuncture or prayer or mindfulness or yoga or exercise or eating healthy foods, all of them are very important techniques that we can practice either with or for our patients or recommend for our patients that help them and their families deal with chronic pain situations.
Thank you very much. There are lots of people who are not aware of the fact that presently medical education requires that the curricula incorporate spirituality in the formation of residents and medical students. And the timing vis-a-vis how much is required in this field may not be such that the residents, the students may be able to learn as much as they would practice as you do. You have been involved in this for almost 20 years, and I don't think that what you know and what you have is something which students can, understand in a few hours, in a few days, in a few weeks, even in a few years. So if you are called upon to be part of policy to address this information, what would you say? What would you do?
Again, a wonderful question. I have a lot of thoughts about this. And as a pediatrician, of course, I think of things in a developmental stage. And I also think about this in an immunization model. So I think that when we have babies, they first learn how to sit up and they first learn how to walk very, very hard. First, they fall a few times and eventually they walk and get the developmental milestones occur in a natural progression. So the same thing has to happen with learning about spirituality, learning about stress reduction, learning about proper breathing techniques, hypnosis, imagery, whatever it takes for a patient to get better. The provider has to also learn very slowly. So you can't just have a medical student or a resident get 1 hour of learning mindfulness and expect them to incorporate that in their practice. They have to, like babies, learn how to do it slowly They have to want to do it, and then they have to practice it at least 3 or 4 times a week for themselves personally in order to recommend it for their patients. And the same thing goes with, if you think about it from an immunization model, in terms of vaccinating against the stressors of the world. I think that many of our providers and many of the medical students and residents do not learn how to basically immunize themselves from the stressors of their practice, from the stressors of not getting enough sleep, too much information, angry patients, patients that get sick and die. They don't have any kind of a vaccine, if you will, and how to manage that. And again, it's something that needs to be done very early, very quickly in their career with booster shots, if you will, also continuously using a vaccine model. But in order to be able to deal with the stresses of being a medical student and a resident, they have to both learn to do these techniques and practice them on a daily basis. And that's the vaccine, if you will, is learning how to do it, and they have to practice it on a daily basis.
There are many people who don't know that you are out there. There are some who may have heard of Professor Quinnin, who is a consultant in psychiatry and in Duke University. There is Christina Puchalski at George Washington Institute of Spirituality and Health. There is Professor Graham at the Texas Medical Center, the Institute of Spirituality and Health, who is also a PhD in ministry and involved in integrative work. Basically, we are coming to realize that you've been there for some time and you are a consultant in pediatrics and you are involved in this. There are many centers today who are doing most of what you are teaching. Uh, I'm sure by the time many of them get to know that you are there with the video and with our presentation in the magazine, your invitations will just shoot up. Now, how will you be able to handle this? Are you going to train more people to take care of some of the invitations you have and places that you cannot go? Or what do you really do? Because presently you already have invitations from people who are part of this meeting. How are you going to manage all of that load and your pediatrics everyday practice?
Well, actually, wonderful question also, because it would be